treat the patients and their family members as if like you are treating your own parents, your own siblings and family members. Hello, I'm Dr. Yee from Malacca, Malaysia. I am the Medical Director of Doctorate. So I'm actually graduated from Manipal University, India. And later on, I further study and completing my master degree in UCSI University. So besides that, I'm a fellow of Medical Academy of Paediatric Specialists in US. Okay, so for the past 10 years, actually, I've been treating is what we call that is specialist children. So mainly on the area of autism, ADHD, Down syndrome, and also children with learning disability. My inspirations, the parents. Okay, so I would like to thank to all these parents and their special need child. Thank you for accepting me into their world. I think again back to the parents and their family members. Okay, the moment they walk in, what we see is sorrow, sadness, very discouraged, So, but after few sessions of therapy, consultations, then you can start seeing the smile, the smile in them, on their face, and then you see the child recover. And I think that actually really inspired me. And I start to discover that, hey, not bad. This is, after all, this is, I think it's a very noble type of job, So that's actually make me keep on going, that I need to do more. All right, no doubt, I think this is a very challenging field, especially in medical field. To treat special needs children and the family member is always not easy. The process of the treatment actually is the same like other medical illnesses. Okay, during the first consultation, usually what we do, or what I did is usually, the first, I think history taking is very important. All right, so under this history taking, we will try to explore on various history like family history, social history, pregnancy history, developmental history, and also we try to pinpoint the what we call that the causes of the child behavior, because most of the child they actually presented with a lot of sensory behavior. So in history taking, we try to actually zoom in. Okay, so after the history taking, then we are actually followed by examinations, for the children. Okay, then followed by testing, medical testing. So this testing usually example of this medical testing is a hair test, urine test, and stool test. So upon the next appointment, that is actually a month from the first consultations. So we have the testing ready. So during the second consultations, we talk about the result, or discussing with the family member on the result, and also treatment. Okay, so basically in the treatment of special need, first I think the most important, I think the parents need to know is the treatment process. They have two parts. The first part actually is what we call that the software problem, which I call it the internal part. The other thing is the hardware, which the external. So what do you mean by software or hardware? Okay, software actually emphasize more on therapy. Example, speech therapy, occupational therapy, early interventions, and behavioral therapy, and etc. Whereas in this hardware therapy, which I'm actually looking into it. All right, this is my expertise on the hardware part. So which actually in this hardware part, based on the history, based on the examinations, based on the testing result, okay, we are actually able to pinpoint, okay, and tell the parent that, okay, your child actually having this, let's say example, heavy metal issue, all right, okay, or your child actually having some nutrient deficiency, all right, or your child having some like allergic issue, okay. So on that part, so furthermore from that, so once the parent understand the concept, we will discuss on the treatment, all right. So but always remember one thing, always emphasize this on to the parents, that I think they have to be very committed along this process, and along this treatment, and along this therapy. They have to be very committed, and there's no way that there's two children, you're going to have the same set of treatment protocol, because these children, they're very unique. They're unique in their presentations, sign and symptom, and also the testing result. In this field, right, there's always difficult to get not only doctors, but professionals related to special needs field. All right. Why? Because there's just too many cases. But the amount of doctors and professionals being trained in this field is actually not increasing as accordingly to the cases. So imagine that parents always tell me, doctor, it's so difficult to get appointments, all right, with whether it's with the doctor, specialist, therapist. Sometimes the parents will tell you, doctor, the appointment can go up to 6 months to a year. If you miss the appointment, right, the first appointment or second appointment, if you miss it, right, you have to wait for another 6 months to a year. So all these professional and also therapists in this field, I think that the most challenging parts in treating special needs children and their family member is, first, is the awareness. All right. Second thing is the acceptance. Okay. We are talking about parents first. All right. The parents first. Okay. So some parents actually they're aware of their children problem, but not necessarily they will accept the child problem. The other thing is, worst cases is, I think some parents actually they are not aware, and they're totally not accepting at all. And worst cases, some of them actually they're rejecting the child and sending the child to this home for like handicapped children. Okay, so this is a very difficult part. So during my consultation, this is the point that I always want to educate my parents. Okay, so to make them aware and accept. So without these two, I think it's very difficult for us to move forward on the treatment part. Right. So in treating special needs patients, right? All right, there's actually no golden rules, right? There's no golden rules, but we have to always remember that. All right, remember these things were being taught by one of my prof. All right, Dr. E, you must always treat the patients and their family members as if like you are treating your own parents, your own siblings and family members. So I think this is a very important concept. So if we are able, that every one of us, if we are able to do this, then I think we can able to help them more. All right, and we are able to understand them more, and which actually, to be very honest, over the years of experience, the result of the treatment, all right, the end result of the treatment or the therapy will be always positive. We are not actually not only focusing on the child. You see, the moment patients, when the family member comes in, right? Okay, so they are all patients, all right? They are all patients, not only focusing on the children, okay? But we have to focus on the parents, the grandparents, the grandfather, the wife, the husband, the siblings. For me, I've been doing this for many years, okay? So meaning that we have to really look into their psychological effect of the family member, okay, before we proceed further on our discussions, treatment or consultations. So this is very important. You know why? So a lot of times, right, I do see, so whenever the parents or the parents, right, and they usually come together, sometimes they come together with the family members, like their grandfather or grandmother, the child grandfather and grandmother. So usually we are being very careful in our words, you see, because a lot of time that I think the blaming game start. All right, the grandmother, you start blaming the daughter-in-law. All right, blaming the daughter-in-law. You see, I asked you to do this, during your pregnancy, you should not do this, you should sleep early, you should take this Chinese herbs. I asked you not to expose spend too much time on the screen, everything like that. Or they will start blaming. See, because of this, now you see your child, right? You are giving birth to a child with special needs. You see, that words actually really hurts, really hurts. All right, not only hurting the mother alone, but actually hurting the husband. So usually the husband will be very quiet. They will be very stay quiet because listening to mama. They cannot scold the mama. All right. So this is I think part of the psychological effect. And the other thing is on the husband. All right. Husband usually, men, right? Men usually they're very ego one man. All right. No lah, I think it's not. They will start thinking lah. It's not from my gene lah. I think it's not from my side lah. So men usually they will act cool. All right. But the moment you see men start tearing, right? Wow. Then you feel very 感動 one. Wow. to make a man tears, I think it's not easy. So this is, I think, this is also another part of the psychology on the father side. And father actually, because of this ego also, right? Actually, this is also part of the obstacle of seeking further treatment. Because of you come back to the acceptance again, all right? To be very honest, I think the term special needs, right? All right, the term special needs is the term that we created. We, the normal, ordinary people, created to differentiate a person, whether it's a special or non-special, right? As I told you, for me, on the controversial part, for me, it should not, right? We should not create or diversify them or group them into special or non-special. But okay, in medical terms, okay, if you were to answer in medical terms, yes, we have to categorize them. Why? Because the special needs children, they need more assistance, right? They need more help, right? And also they need more access in terms of medical care, all right? So for me, I think it depends on your perspective, all right? It's each individual perspective on answering these questions. So if these special needs children, right, they do not being treated as early as age like 3 or as early as we say below 7 years old, right? So how do they actually affect their future? So that's why I always emphasize, all right, this is the same question that being asked by a lot of parents also and their family members, all right? I emphasize on early intervention is very important. So the golden opportunity for treatment is, for any early intervention, is between 3 to 7 years old. Alright? So why we need this early intervention, why we need to emphasize on early intervention is because we don't want them to be burdened, alright, to the family members and to the society and as well as the community. Alright? So at the end, we want them to live as independent as possible so that they can able to take care of themselves. They're able to take care of their needs and also they're able to protect themselves. How do they survive? How do this special needs child survive in the future? Okay, I always tell this to the parents. Again, it depends on the severity of the child. All right, there's a mild, moderate, and severe. For those mild to moderate, I think we should not be any problem. So we are very confident that they can survive. Okay, of course, all right, they can assimilate into the society. So there's no problem, but they must have early intervention. But what we worry now is those children in the severe, right, those special needs, which actually categorize into severe. Right, severe meaning that they are unable to take care of themselves, they are unable to actually meet their basic needs, right? Like in terms of toileting, also they need help. Eating, they need help. Clothing, they need help. They need help in every other any other parts aspect. So these are the group of patients, the children that we are worried. All right. So what are the worries for their future? So very common. So usually the parents will tell you this, doctor, I'm so worried that if one of the day when we are not around, both husband or myself not around, how is my kids going to survive? Alright, we are so worried that they are being bullied, they are being rejected, and worse, they are worried that they are being abused. So I always get this kind of question, worries from the parents about they're worried about their future. You see, the difference between special needs child and normal child. To be very honest, there's no difference. Right? So whenever people ask me this question, right, I always tell them there's no difference. Doctor, why you say so? There's no difference. Yes, I say no difference. Actually, in fact, there's a lot of lacking actually in the area of special needs. I think the first thing is the financial support. Financial support actually is a main obstacle for a lot of parents to seek early intervention. Then the other obstacle is the therapy, insufficient of therapies. Because I think most of the youngsters, right, so they are not keen to take up this course. In terms of this, government support is always there. It's always ongoing. But I think the only thing is lacking. Lacking in the sense that I think they can do better. Alright, the government can do better by providing more assistance in terms of financial. So we have this model. I mean, we always talk to the government in hope that actually they can provide a lot of this, what we call the financial supports to the NGO, and let this NGO runs the programs, actually the program related to special needs. But I think at this point of view, I think they are still lacking. We hope that I think in future, so government will actually provide more assistance. And of course, I think the other thing, the other obstacle or the other insufficiency is a lack of professional, right? Medical doctors and also this what you call the clinical psychologists. So in managing or treating these special needs children. So whenever I go everywhere, I meet everybody, I always share my dreams. Actually regarding dreams of I think creating awareness, among the society in special need. I'm so lucky that actually when I proposed my ideas to Dawnbridge actually take up the challenge and they came back to me and also they proposed me so that we can work together. Give me a lot of what we call it, a lot of freedom, a lot of supports in order for me to achieve this dream together with Dawnbridge. And the other thing that what I like most about Dawnbridge is the team. The team of young people full of dedication and determination, right, to achieve the dream together. Our end goal, as we actually discussed with Dawnbridge, I see our end goal is we want to create a closed society where we can actually accept the presence of the special needs kids, all right? And also our goal is to bring Dawnbridge to every corner of the world. Whenever there's a special needs children or community, Dawnbridge will be there to assist them and to help them. I think the major role is how am I convince all these professionals to come in together and to work together for the betterment for the special needs children. Because you see right now what happened that the services actually is very disintegrated. Alright, we are not communicating. The professional is not communicating with each another. So the parents, the therapists, the NGOs, the volunteers, the donors, they are not communicating with each another. So with me coming in mind, we hope that we can create a link, all right, for these people to come in together, and so we work together as I told and mentioned earlier, okay, to create a safe, love, and also healthy society for all these special needs. Dawnbridge coming in, right, definitely is one of our what we call one of our objective. Our main objective is which actually we could be the catalyst, okay, catalyst or the platform to link this government, the private sector, the NGO, and the community as well. So definitely it's going to be in our plan to all these young coming therapists or professionals. So there's two things that I would like to share. One is love. Okay, love is very important. So without love, no matter how knowledgeable you are, you won't go far. The other thing is respect. All right, you should respect the rights of these special needs children. So as I mentioned, always emphasize, we have to respect their presence. They have all the rights to live together with us. So these are my two main advice to all these therapists. Okay, love and respect. Okay, my advice to all these young couple who are actually preparing to get pregnant or first-time father or mother, okay, please don't be too discouraged. Please go on with your plan, all right? So first advice is very simple. If you have family members or family history, a strong family history with autism or any special needs related children, okay, first you can actually go to seek advice from the genetic counselor or the genetics professional, alright? So which actually the service is there. The other thing is, okay, a lot of young parents, I think if you are actually engaged with substances abuse, this one I have to emphasize, substance abuse like drugs, okay, chronic, if you're on drinking, a heavy drinker, or you're a chronic smoker. So my advice to you all is, before you get pregnant, please stop all these high-risk behavior in terms of like taking drugs, taking excessive alcohol and smoking for at least 6 months to a year. So before you get pregnant. So that will actually help you to reduce your risk in getting a special needs child. So later, once you get pregnant, for the young mom or first-time mom, once you get pregnant, always go for follow-up, alright? Okay, you must always, don't miss the follow-up, okay? Go for the checkup, And upon delivery, the follow-up with the government hospital or with the private doctors is very important. Never miss it, because during this follow-up, right, so these doctors or pediatricians, they will actually follow up your children's growth and development. In case there's any delay in any stages of their growth and development, so the doctors actually can pick up the sign and pick up the symptoms as early as possible. As I mentioned before, the golden opportunity or the golden period of any early intervention or treatment is between 3 years to 7 years. So this is my advice for all the young parents and parents to be. Okay, thank you.